Greetings again. This is Dr. Bill Wyatt, and we've put these cases of non-surgical correction of class 3. I have probably 8 or 10 cases like that we've done over the years where we did this without the surgery. And I've also have done the surgery with different orthodontists. I'll explain one of the cases after I finish going over this. Now, this case we started 37 years ago, but actually I had been doing this for several years. Maybe 40 years ago, we were correcting malocclusion by doing non-surgical stuff. Now we'll go in here and I'm going to show this. We'll fix it up here. Let me get it. Now here is this case that we did. Now this was I started it in 1987, and this is about 20 years later. Here is the lady. She's a stewardess for Southwest Airlines. She's still working with them as far as I know. And I've got a picture of her just recently, 37 years after we started here in 87. And she's still got a perfectly lined face and no evidence of class 3 at all in there. I'm just going to show quick stuff on it. You can go back and get every picture we took of her on the way. We used a lip bumper. Looking at it from the front, the vertical height is almost perfect in here. We did not open the bite and make it any worse. We brought her upper jaw out and filled this out. You can see a deficiency in here. And this is where the chin was out. I thought we'd have to do a genioplasty on you, but it didn't have to. It looked perfectly fine back here. Let me go back now and show it from the beginning. All right. Right in here, this profile is ideal as far as Caucasian people or the way people enjoy looking this way. This was the class 3 side over here. And here it is. It was about 20 some odd years later. It's still looking good. And when she smiled, it's good. And I did about 8 or 10 of these cases, and every one of them has held up, and we have not had to go and redo them in any way. Now, here is her face, and this is this is just recently, actually 24. Just a few weeks back, we took this picture. She visited Glen Rose here, and visited a friend that we knew, and she took her picture, and this is her 37 years later, right here. It was 1987, and it's 24 something here. And if you figure that out, it's about 37 years. It's still holding up like that. I'm going to show their x-rays on it. We started out with her teeth were here, and these were beveled out that way. We brought the lower teeth back. Pagonian didn't change. It stayed out there, but the teeth we brought them back into this area here. And yet the begonian and sticking out here, we thought we'd have to do a genioplasty or send her in to do that, but it looks great without it. And so this is my defense of doing this type of orthodontics rather than going in and doing the surgery. Here it is. This is 91, that was 87, and that was should be like 4 years after we started it. We ended up like that in 91, and that's the way the teeth have held up through these years. There it is from the side, and this is definitely a class 3. This is a 6-year molar right here, and we took this tooth out and slid this tooth up to class 1 and brought these teeth back to class 1 doing this case. Now to bring these teeth back like that, we pulled them back by pulling forward on the upper teeth. So this is what we did, and when I scrubbed in on one of these cases, and we started at 7 o'clock in the morning, I had worked with several orthodontists, old surgeons, and they knew I knew how to do this. And so one asked me to scrub in with him on this case, and he had 2 or 3 students studying there, and I helped him do the case. And we sectioned the maxilla loose up here above the teeth and dropped it down out here. And this is an ungodly type of surgery, and brought it out, and he shortened it by trimming the bone structure in the sinus, and then we picked that up. It changed this woman's facial structure. We worked on her till 1 o'clock. We lengthened we shortened her lower jaw, and we did a genioplasty on it also. And it took that long to do the case. And the man put that up, and I helped him wire the maxilla back up. He asked me how it looked, and I looked at him and I said, "Man, don't ask me that. I'm sitting here praying this woman's going to live." And so I helped wire it back up there. In 3 or 4 weeks, the surgeon watched her or took care of it. He sent her back for me for the finishing orthodontic work, and she came in the office. Nobody knew who she was. She was looked so much better, everything. Well, this case has done the same thing, and I have checked it out from one end to the other. This can be something that will replace surgical orthodontics for many, many cases that come into there. We've done a number of these cases, and none of them have relapsed at all on that. And however, I have a method of retaining cases that were class 3, and I'm going to try to do a little video on that when I get through with this right here. Now let's see if there's anything else in here that we showed. And this was the other side. It was the same way, but we had to expand the upper arch, and we did that with the Big Daddy arch wire, bringing it out like that. Now here was the upper arch when we started, and here it is in 91. That's on the bottom. We turn this tooth around and torque the root back in here, and you can see how it's held up from 91, and it's still there in 2024. It's still there. So this is the end of this part of it right here. And I want to thank you for watching it. But we want to defend that, and this is better, and I'll put it up against any surgical corrected case and show you that we did the same thing to it. We advanced the maxilla, expanded it, and we brought the lower teeth back. If you run in, you don't have enough force to bring the lower teeth back, you put some screws in the bicuspid teeth and hold them in position and pull on them some more, and you can pull those teeth back to wherever you want them, as far as you can advance your maxillary teeth and cover this up and correct the class 3s like that. So I'm going to stand on that, and if people look at this and say that you got to have, I appreciate the surgeons. I hate to take things away from what the surgeons are doing, but one of those double jaw surgeries today would probably have cost you close to $100,000 to do that much work on somebody in there. Whereas we can do that with orthodontics for one fraction of that amount, and it's just as stable as it can be there. So I'm going to stand on that. Thanks for watching, and I'm going to hang up here now. And so people may look at this and criticize it, but to me, if you find anything wrong with it, show me what's really wrong. Don't just tell me you're wrong. I have not found anything, and I haven't found anybody else that's found anything wrong with the way we did this type of malocclusion. We brought these teeth forward. We used a lip bumper to run interference for them, and on the bottom we brought these back. And I thought we'd have to do a genioplasty, but we didn't. It looked great. So I'm going to close out now. Thanks for watching, and we'll check you later. Bye-bye.